All right, this is Senate Health and Welfare, and it is February 27th. We're back. This morning, we're looking at S302, what we have called our Alzheimer's bill, and we've received, we're asking Jay Green come in and offer some testimony about the bill itself, but mostly, Jay, I think what we'll be interested in is the translation information that you had sent along. So welcome and go right ahead with your testimony.
Thank you very much, Chair Lyons. My name is Jay Green. I use they, them pronouns. I'm the Policy and Research Analyst for the State of Vermont Office of Racial Equity. And I'm very pleased to be here testifying on S302, the Dementia and Alzheimer's Public Outreach Bill. I provided a written copy of my remarks via email just a little while ago, so the committee will have it for future reference. Yeah, I will just go ahead and give a brief overview of our remarks on the bill, and then I'm happy to take any questions about language access services that the committee has after that. So I wanted to say that the Office of Racial Equity is strongly in support of conducting additional public outreach and education on dementia and Alzheimer's. There are significant racial disparities in both the it's sort of a paradoxical thing where, according to data from the National Institutes of Health National Center on Aging, quote, Black participants in Alzheimer's disease research studies were 35% less likely to be diagnosed with Alzheimer's and related dementias than white participants, despite national statistics that indicate that Black Americans are overall about twice as likely to develop dementias than whites, unquote. So there's a paradoxical thing where Black Americans are more likely to develop dementias and Alzheimer's, but less likely to receive a timely diagnosis and care for that. So this is, our office is definitely in support of taking measures to narrow those gaps. And I also wanted to note that being a person of color or being Black is not a cause and effect relationship with developing dementia or Alzheimer's. The race is sort of a socially constructed thing. There's no real genetic basis in race. Rather, being Black is highly correlated with other environmental risk factors that lead to developing dementia and Alzheimer's. So, for example, if you're Black, you're more likely to live in a neighborhood that's been segregated and have a history of redlining, where you're going to be exposed to more air pollution, which is a risk factor for developing dementia or Alzheimer's. You're more likely to live in a food desert where you're less likely to have access to healthy food choices. You're more likely to work in a job where you work a night shift or a swing shift. All of these stresses, environmental factors, and disruption of circadian rhythms can lead to higher rates of stress-related illnesses that can predispose people to developing dementia or Alzheimer's later in life, like type 2 diabetes and cardiovascular disease. So I think it's important to note that when we hear statistics like Black people are twice as likely to develop dementia and Alzheimer's, we don't think, oh, being Black is the cause of that. No, it's the history of systemic racism and environmental injustice that is the risk factor there. So thank you for letting me make that point. I think that's really important when we're talking about statistics, that we don't confuse correlation with causation. As far as the draft, I'm providing comments on draft 1.1 of this bill. There was only one very brief language change that I wanted to suggest to the committee, which is on page 2, line 14, where it says,
Wait, there's no 14, the bill's only 3 pages long.
Page 2, line 14.
Oh, line 14, oh, cute. I was writing a note to Kiki at the same time. I'm sorry about that. Go ahead.
No worries at all, thank you. So page 2, line 14, it says, the necessity of ensuring patients have access to translation services when appropriate. I would suggest replacing translation services with language assistance services. And the purpose of doing that is to align Vermont state statutes with national federal guidelines on language access, which usually use the term language assistance services or language access services. And also because language assistance services are a broader kind of all-encompassing category for any kind of assistance that someone might need, including interpretation or translation. Yeah. This is a fine point, but and it might seem a little bit nitpicky, but you know, we're talking about statute and language is everything. So translation is generally a term that's reserved for, in technical terms, it's when someone is taking a written or pre-recorded piece of media and changing it from one language to another language. And interpretation is the process of facilitating communication between people who use different languages. So small difference, but it's important that we use the correct words when we're talking about making policy that's going to affect what people have access to. So in this case, it's important that people have access to interpretation during their medical appointments and not just translation of written documents like their intake forms or public outreach materials.
Yeah.
But it's a very easy mistake to make, and also I was not fully aware of the difference between translation and interpretation until I started doing research for the Office of Racial Equity's language access report that I was the principal drafter on. So it's a very easy mistake to make.
Yeah, and Jay, interpretation is typically happening in real time, correct?
There are many different subtypes of interpretation, but typically, yes, it's happening either in the room or via a remote video relay service, that kind of thing.
Okay, all right. So Jay, the specific changes that you would make are, I see in paragraph 2 on page 1 of your testimony. So language assistance services and
that was the only change that our office was recommending. I recall after watching testimony from last Tuesday, February 20th, there was some discussion about whether to add the Office of Racial Equity as a named participant in the public outreach process. Our office does not favor being added as a named participant along with the Department of Health and the Department of Mental Health. We want to empower other state agencies to take on the important racial equity work of doing this kind of project rather than asking the Office of Racial Equity to be sort of the holder of all equity-related work in a process like this. But we are more than happy to provide technical assistance and additional assistance to the Department of Health and Department of Mental Health and community coalitions as requested.
okay, that does make a lot of sense. Thank you. Other questions for Jay? So we can make that change. Your expertise is very helpful with this one. Thanks.
Thank you very much for the opportunity to testify, and I would be happy to answer any questions on language access. The written testimony that I provided has a more detailed outline of answers to questions that were raised in testimony last Tuesday about things like interpretation and use of automated tools like Google Translate, things like that.
Thank you very much. Okay, it's great. I think we're good unless there are other questions. Good? All right, thank you. Thanks for being here.
Thanks, Jay.
Thank you very much.
So Katie, that doesn't seem like a huge change to the bill.
Just changing translation services to language access services.
Would you mind coming up just briefly while we look at the bill?
Sure.
Because there were some yellow highlights in the most recent draft. Right. It's interesting. I just before we get there, I had an email from someone I know in my district, and she was following the committee when we were talking about this bill, and sent a little note, a long email to me about a lot of things, but this, she sent an email about this on 302 and said, there's an effective free medical translator app called Care to Translate. So there's stuff out there for both patient and provider, and it translates in 45 languages, extremely easy and efficient to use. So that was.
Okay, who sent this to you? I'm sorry.
Sharon Goodwin, who is a physical therapist who owns Rehab Gym, and she just happened to be listening in. So sent me an email.
And did you see the email I sent, with the link that Jess Oski provided about the UVM and the UVM?
Oh, I did, yeah.
Excuse me.
We haven't gotten to the principal yet.
Yeah, sure.
So did you want to put something into the bill based on that?
No,
Okay.
it was just informational saying.
Yeah, that's
And
it.
it confirms what Jay was saying too about they're required, et cetera.
Okay,
All right.
come back.
See ya. Before we move on to the next thing, I wanna give this to Kiki. Are we gonna be 401 since David's not here? I mean, Senator Weeks isn't here.
On
This is H 469,
69,
the Ulysses.
yes, yeah, do
Okay.
that. And then we can also make a comment. And I do want to find, no, I don't want to do that yet. I'll tell you why. I want to see if he's going to vote on this.
Okay,
So we can hold it, and he should be back this afternoon.
okay.
So you can ask him, and you can ask him that question in education.
Okay. Kiki, in the meantime, could you just put it on your desk so I don't lose it?
Yes. Okay, so let's go to 302 briefly, and then we'll be right on schedule for Susan Lasky. You had some yellow highlights in here and draft one.
What's the drum beats outside?
There's a day going on.
Okay.
I'm sorry, Kiki, I had you print the wrong document. Could you print the amendment of 302 for me for today? Thank you, I'm so sorry. Letting me share the document I would like to share. I'm so sorry, I'm doing what I always do. And it is not letting me share what I want to share.
No.
Uh,
Are you trying to share your screen?
I'm trying to share the bill 302 amendment. Well,
We do have it.
do you want to look at it on your own screens? I don't know
I
why.
can do that. Do you have it on your screen, Terry, or, Senator Webb? See if we've got it.
I could log off Zoom and come back if you want.